Okay, my name is Miracle, and I got to know about the Rivchpp package from Health Center Rebo. That's where I was able to subscribe, and I was referred, I think, around 8 months, not 8 months, 9 months, Admission Hospital to do my CS because that's my means of delivery. So I came here and I came with a referral letter and I was accepted here and I started coming for antenatal and I had my baby. It was stress free. Everything went on well and it's been a wonderful time here. Anyway, the facility is okay. The treatment from the staffs, the doctor has been receptive so far. And I think is a good initiative from River State government and has really helped us to cut on the cost considering the way things are now in the economy. And knowing that CS, we can't really, you don't really know how you're going to deliver as a woman. You might want to go in for vaginal delivery and something happens and people can, if you're not careful, it can escalate, the problem can escalate and become something else if you don't have the funds on ground. But because of this package, you can just have options. Like me, I went elective because of my first experience and it was okay. And now my baby had jaundice and my baby's on phototherapy and it's still under the package and it's just been helpful to families. And I really want to appreciate River State government. Thank you so much for the help and also the management and staffs of Admission Hospital for cooperating with the government, at least treating us with all fairness. Thank you so much.
Benjamin Bless from River State. So it's my stomach problem. So when I went to Uzoba Health Center, so they now refer me to this place after the scan and everything that I did. So they now refer me to this place for the operation. So the operation was done successfully yesterday by 4 p.m.
All right, good afternoon, viewers. You're welcome to another episode of the Rivchpp Testimony Thursday. And I'm here again with the HOD Planning Research and Statistics, Dr. Juliet Aleme. Good afternoon, ma. How are you doing, ma?
I'm fine, thank you.
All right, we'll go straight into the video. In the video we just watched, we saw two women, and one of the women first complained about having a stomach problem. And she was first at the Uzoba Health Center, and she was later referred to a secondary care facility where she had to undergo a surgical operation. And then the other lady also had a reason to be referred from the health center to a secondary facility where she had a cesarean section. And afterward, she also had her baby go through phototherapy. So we'll start with the first lady who had the stomach problem. I think people would want to understand why, after complaining of having that stomach problem, she needed a surgery. All right, ma.
Okay, actually what she talked about, the surgery she mentioned was myomectomy. Myomectomy is a surgery that is done for women that have myomas, leiomyomas, but that is a medical term. We just call it fibroids. A lot of people know fibroids. So that is a surgical operation for fibroid conditions. Fibroid is very common amongst us. It's very common amongst women of reproductive age and usually results from late childbirth most times, and it could also be genetic. So most times you find women that are within the reproductive age group, within Nigeria it's 15 to 49 years of age, coming up with fibroid. It does have some complications, which could be like pain, what she mentioned, she just had abdominal pain. So when people have pain, it's not all pain that can go away with just simple paracetamol like we take. So for this particular type of pain she had to go for an ultrasound scan that had to show that there was a growth. Fibroid is actually a growth within the womb, and it does have it has some complications which could lead to infertility. That is a condition where a woman could not be able to bear because of the location. Fibroids are found in different locations, and depending on the location too, it can lead to excessive bleeding during a menstrual flow, and then you find a woman having to change so much, pale, and the woman may have to be transfused even after her menses. And another condition is the pain which she complained about. So it's actually a very a condition that could actually lead to negative impacts for a woman. Yeah.
Okay, thank you very much, Ma. And so she mentioned that she was at the Ozoba Health Center and then referred. So I believe because of all of these complications, this is why she had to be referred from the health center to the secondary facility.
Yes, exactly. Fibroids are not managed at primary health care level because primary health care levels are not to do surgeries. So whenever there's a condition like that, it's a surgical is actually a gynecological issue, and obstetrics gynecology is actually surgical in nature. So she needed to go to a higher level where she could have it opened up and then a size so that before it leads to their consequences and conditions.
All right. Thank you very much, Ma. So
Yes.
the next lady who had the cesarean section and afterwards jaundice was observed in her newborn, and then the newborn had to go through phototherapy. So I know that River State Contributory Health Protection Program is particular about reducing maternal and infant mortality rates in River State. So, Ma, could you please just explain more on all of that?
Okay, so that is the beauty about Rivchpp. That is the beauty about the River State Contributory Healthcare Protection Program. We have what we call the vulnerable group, and amongst that vulnerable group, one of the categories that we are very particular about is women, of course, women of reproductive age, pregnant women specifically. They are part of our vulnerable group, and then of course, children under 5. This is because Nigeria has a high maternal and infant mortality. A lot of women die during pregnancy, and a lot of children die before they get to 5 years of age. So this woman that came, first of all, she had dual benefits. She had a cesarean section because of some conditions that warranted her to give birth through the cesarean section. And then also her baby was noticed with yellowness of the eyes, which we call jaundice. And for this condition, it wasn't the physiological that will clear. One of the ways that this is dealt with is phototherapy. So because she was enrolled, her baby had to enjoy the benefits of having phototherapy free for the baby. And this procedure, this service we are talking about is not cheap. It doesn't come cheap, and it's not all facilities that even have the facility to even take care of it. So she had this benefit. She was, of course, had a cesarean section, and her baby had phototherapy covered, and mother and baby doing well. I mean, that is just so much for a little token that she paid for the insurance.
Thank you very much, Ma. So, viewers, you've heard from our dear HOD, Planning Research and Statistics. As an enrollee, her baby also had to enjoy all of the services and benefits. All right, it is until we meet again, same time next week for another episode of the Rivchpp Testimony Thursday. We say bye bye.